Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center. Ask the Doctor Anything. We are in Southern California, and we have 6 physicians, healthcare providers. We practice functional integrative medicine along with our training and, medical degrees, naturopathic degrees, physician assistant degrees, and just our experience in trying to sort through many of the questions our patients have about natural health care and the like. So we like to do this once a week so that we can look at questions our patients are struggling with, and we start to see and learn from you patterns where we might be able to educate better, spend more time. Today was our monthly clinicians meeting. We stop seeing patients at lunch for a couple of hours, and we do case presentations if we have challenging patient situations, and we all put our heads together sometimes to address issues. We look at relevant articles that may be of interest, new breakthroughs or affirmations of physiology and new drugs or things like this. So it's much like grand rounds, and we're so happy to do this. We are also, looking to continue to expand our videos and the topics and the number of hours. For me, this is the end of a long day of work. And so I am happy to be doing this every Tuesday at 6 p.m. But we are going to be having other doctors do this so that maybe I can take an occasional break. But we do this for your benefit, and we always learn. To be a doctor, we say here, is a commitment to always being a student of the medicine and our patients. Well, anyway, so we have email questions, and if you are on our email list, you can get a notification of Ask the Doctor Anything, and there'll be a link on that email, and you can click on that and type in the question so it goes directly to the list here, so I can get this. I don't get them ahead of time to study them ahead of time. So I'll do my best to try and answer these questions. The next thing is we have the chat on the side here. So again, if you have a YouTube and you're a member, you can type in a chat question. I'll try to defer to the chat first, always, for the live audience, people that are here. If you find this of value, again, we're asking you to hit the like button and subscribe and share. We also ask you to put a comment at the bottom. These are apparently methods by which the exposure gets to more patients, more family and friends. And we do a write-up in script of this under the blog at our website, tlcdoctors.com, tlcdoctors.com. And you can look at the blog, our website, and that way you can look at the question topic, and maybe there are certain questions you wouldn't want to waste your time looking into, but then you might see one that catches your eye. So we're trying to do various ways to bring a cohesiveness into the many different viewpoints that are out there in the internet world on these things. And at least you'll be able to see how we here at Tustin Longevity Center, with our science-based, evidence-based clinician experience, our clinical meetings, how we're coming to our points of view. So we'll start with our chat. We are starting to get some questions coming in. One from Gunnar that says, do you know anything about varicoceles in men and any biblical advice about it? I want nothing more than to do what's right. I have a wife and kids. Should I worry? Usually varicoceles, what this is in the scrotum, there are veins and arteries and nerves going to the two testicles. And there are in these veins areas that could be injured with a varicose vein. So that's a varicocele. They can become palpable. You can feel them just like any tortuous, knotty vein like you see on people's legs. And they can become painful, and then there could be, due to the slowness of the blood flow, there can be some turbulence in the blood slowing down, stasis we call that, and clotting. This is normally not a serious thing. And very often the urologist is someone who would do a male exam. Normally they'll have you exam in the entire area of your genitals. And then they'll often ask you to bear down like a bowel movement, which will put pressure on the vein wall, and they're more easily palpated. And the urologist can get a better fix on where that varicose vein, so to say, in the scrotum. And again, these are usually benign. What would be some natural ways to address this? One of the natural things is drink water, lots and lots of water. And to take systemic enzymes. Those are enzymes like streptokinase, bromelain, nanokinase. These enzymes are taken on an empty stomach. What we use here at Tustin Longevity Center is vascuzymes, systemic enzymes. I would take, for an average adult male, 160, 80, 90 pounds, I would probably use 5 twice a day and have them do that on an empty stomach morning and evening. This disinflames the whole body. The water helps disinflame the whole body and any potential blood clots or static blood in the varicocele there. And it promotes healing when inflammation goes down. Now, why would a vein bust out, and why would the blood vessel wall expand like that, like have a balloon out in the wall of a hose? Well, the elastin collagen of the walls that make up the membrane in the veins, arteries, nerves, these areas have protein, elastin, collagen, hyaluronic acid, and they depend on vitamin C as well for activation, and minerals, and a low carb diet. So if you're low in your minerals, low in eating protein, low in your vitamins, you're low in vitamin C, and you have underproduction of enzymes, then the wall can, under the pressure, get a ballooning out, okay? And it's this ballooning out that makes the varicocele or tortuous veins in the leg or anywhere in the diverticula of the colon, the little sacs coming out. So we would tell our patients, be very low carb, eat more like a carnivore, and that would get the sugar, the starch, the carbohydrates, the fruit sugars way down. By drinking more water and taking enzymes out of empty stomach twice a day is like soap suds in a sense, or like little Pac-Man eating through the blood vessels to clean it through. By taking a multi-mineral, ours is TLC multi-min, we use the highest quality. Albion manufactures these as amino acid chelates, like magnesium citrate, potassium citrate. These are amino acid chelated minerals. They're much better absorbed. And that helps with smooth muscle activation and relaxation for peristalsis and so forth. And your veins and your blood vessels some of the larger ones do have smooth muscles, especially the arterioles, arteries, small arteries. And so using the enzymes will clean up any debris. And I would say it would take about 3 months of doing this to see an actual reduction in the actual size. It'll take just a week or two to actually see and feel the difference. Now, often the urologist will just have you follow up. Maybe they'll tell you to sit in a Epsom salts bath. And yeah, that might be helpful, but really what you need to do is change your lifestyle with lots of water, lots of enzymes, and a multi-mineral that has zinc in it. Zinc helps with the male testosterone production in especially like, I would say 25 to 50 milligrams of zinc a day. And that's how I would approach it. And then, of course, there's surgery that can be done, but that's a last resort. But to reassure you, it should not affect your sperm production. In fact, this healthy lifestyle will augment your fertility and sperm activity and sperm count by eating more healthy free-range beef and chicken and fish and pork and eggs with the yolk in it, and that kind of a diet to help build healthy membranes. Let's see, what else do we have here in the Dolores says, hi, Dr. Rita. It looks like I may have fungus on my toenails. The nails are brittle and discolored. I used to play soccer and may have had it for years. What do you recommend? God bless you, she says. I would have my toes in the air, open air as much as is possible, in the sunlight as much as possible. I would be as low carb as I could, because remember, fungi, yeast love high sugar, high fruit sugar foods. I would do similarly, taking the enzymes, and I would put Argentine silver. Argentine silver is a liquid silver, 23 parts per billion, and I would spray it on my toes morning and evening. It would be right next to my toilet seat, so while I'm sitting on the toilet, I could spray my toes every morning first thing, and before I go to bed, most people empty their bladder, and I would spray my toes in the evening. I would get new shoes if there were fungus in the shoes. Maybe you need to change your soles or get some new shoes. And then it'll take, if it's your large toenail, it's going to take a full year for you to see the difference, living the healthy lifestyle of a very low carb diet, taking enzymes, keeping your toes in some sunlight, and using the Argentine twice a day. And that's how I would do it. Juan says, hello, Dr. Rita. What are your thoughts on DMSO, dimethyl sulfoxide? That I don't have any negative things. It's a super solvent, meaning DMSO has been used over the years to be a carrier and help deliver and dissolve, carry through membranes, other medicines. And so it has been used a lot. It doesn't smell good because of the sulfur component. It had been put in chelation therapy many years ago. We don't do that anymore now. And so, I have neither negative thoughts about it nor particularly useful, favorable, because I haven't needed it, Juan. Everything I've needed to do has worked out very well. And then Gunnar says, thank you. Okay, well, praise the Lord. I hope that reassures you, Gunnar. That's pretty common. Now let's go to some of the ones I got on the email. There were a couple I didn't get to last week. I'm going to go to those, so I'm always catching up. That way, I try never to miss a single one. So this is from last Tuesday, June 6th. Dawn Marie says, Thank you for caring so much about all your patients. Do you have suggestions for a type of diet and or supplements for someone who has test results indicating APOE 3/4 as a risk factor for Alzheimer's? APOE, these are tests that we do genetically, looking for the genetic SNPs that are associated with um, methylation processes, putting on a carbon with three hydrogens on it. That's called a methyl group in organic chemistry. And it is a way of quieting down the reactiveness of a molecule or an enzyme. And there are enzymes that can take off that methyl group and activate that protein or enzyme or whatever the job is of that molecule. So if you don't methylate things well, it is associated with the inability to kind of quiet things down in a general sense in your body. And that is associated with things like Alzheimer's, dementia, and cancers, and really any disease, because everything does require some form of methylation and demethylation processes for being alive. Now, what do we do to get around that? Well, not to worry. We use the vitamins like methylated B12, methylated B complex. That's why I only use high quality B vitamins. They do cost more, but then they're going to do so much more for you. So if you take methyl B12, folic acid, methylated B6, or a methylated B complex regularly, this tends to mitigate and stop the risk for Alzheimer's. Now, we just don't think Alzheimer's is a methylation problem. That is one of the identifying features down the road. If you live a healthy lifestyle, you can usually mitigate getting into any full-blown situations. So everything we teach here: drink your water, exercise, 150 minutes a week, 5 30-minute activities, including some of which in those 30 minutes you're doing some resistance weight training, aerobics, stretching, Pilates, 5 times a week, 30 minutes. Being low carb, never eating late, getting adequate free range proteins and wild caught fish, prairie raised eggs with the yolks, prairie raised chicken with the skin on it, roasted, nothing deep fried, avoiding processed food, low carb, raw dairy only. If we do these things, taking methylated B complex, being with a functional healthcare doctor that can measure homocysteine, which is a reflection of the adequacy of getting methylated groups back into your body. So even though you have the SNPs, you're overcoming it with other methylated groups that are donors for the rest of your body. EDTA chelation therapy improves the microcirculation to avoid the damage and the shrinkage of the brain. If you keep the sprinklers going with EDTA chelation for microcirculation, you get tremendous value. I have taken countless number of people with memory problems who have started chelation, gone on a methylated B complex, taking systemic enzymes, not eating late, adding in exercise, low carb, eating more of the healthy fats that we need, the linoleic, alpha-linoleic, that are in the foods I just listed. And then with all that, and very often with natural hormones, none of this will show up, even if you have the SNP. Just like people who have the BRCA gene for breast cancer, they're not doomed to get breast cancer at all. How do I know? I have 40 plus years practicing medicine, and so few of the tens of thousands of women who have been on natural hormones that are in our care. We don't have 1 in 8 patients decade after decade after decade being under our care that are getting breast cancer. And even if later in life, because we all will get older, we all will have breakdown, we all are going to eventually die. Even if you're getting into your, your 70s, your 80s, and they do find some cancer, it's usually not anything serious that isn't manageable. So don't worry about APOE, 3 out of the 4 SNPs. Live the healthy lifestyle, all right? And that should help you, Dawn Marie. Juan says, thank you. All right, and Outlaw says, are you aware of emotion code? I don't know exactly what you're referring to there, Outlaw, but I do know that our brain is very complex, and our midbrain here in the brainstem along our autonomic pathway, where our automatic swallowing, breathing, blinking, that salivation, heart rate, all these parameters, there are located in this part of the brainstem certain neurons that are in fact linked with identification of our sexuality, our attractiveness to the opposite sex. This can be damaged by estrogen mimicking pollutants. If you're around, for instance, atrazine, or around other pesticide, herbicide, volatile organic acids, PCPs, plasticizers, and even in our athletic clothes, these synthetic athletic clothes are often mixed with some of this synthetic estrogen mimicking stuff that can affect the midbrain receptors. I don't know if that's what you're talking about. All right, so Dr. Bradley Nelson's work on the emotion code. All right, they have a film called E-Motion about emotions and health. Yeah, so you know how I take care of my emotions? I read the Bible every day. I read 4 chapters every day. Usually it's the very first thing I do every morning of my life. And I just think of what he suffered at the Garden of Gethsemane to pay for my sins and die on the cross for me. And he said, not my will be, but thy will. So I always start with, what is your will? How can I conform myself? You know, Paul said, for me to live as Christ and to die as gain. I am so happy serving other people. I am so full of joy with the idea of focusing on not what do I want, not what vacation I think I should have, not what party or a romantic event I should have. Rather, I want to focus on, you know, what does my family need? My new married niece, what could she use? And on like that. What does the clinic need? How can we improve the clinic? What do my patients need? And then, you know, God will raise up in his heart some verse in me, and he'll remind me, you know, to take care of myself so I can take care of others. And he'll remind me to drink my water and get those vitamins down my throat every morning, get my body out there and exercise, never to eat late. And so the emotional code for me is reading the Bible. So there you have it. All right, so we have a few more coming in, but thank you for that. I will keep this Outlaw, and I will look up that film called E-Motion about emotions and health, Dr. Bradley Nelson's work. Thank you so much, Outlaw. All right, Christina says, hello, Dr. Ellithorpe. I hope you're doing wonderful. I am. I have a few questions on traveling. Do you have recommendations for traveling for motion sickness? Yes, and that is fasting. And if you have to drink anything, I would drink extra water with like sea salt in it. Put a pinch of sea salt in it, so you get the minerals, and take lots of enzymes like systemic enzymes, vitalzyme, or vascuzyme, because all really that is traveling is your vascular system is under stress, and the flow dynamics of this and your loops of Helene, sinus congestion are best served when we're on an empty stomach during the travel. Of course, if you look at trees and you keep seeing them passing you in the car, for some people that's a trigger just from eye motion, which simulates the unstableness of vertigo and the stigma of the eye wiggling during that phase. So some people need to wear, so to say, blinders when they're on a travel. But if it's airplane travel and things like that, I would just go on a fast, and I would take like broth, chicken broth. I would take water with sea salt in it. I would take a bunch of systemic enzymes, and I would, what else would I take? I would take antihistamines that are natural, like dehis, quercetin. And that is what I would do. Now, yeah, you can get dramamine patches, copolamine patches, which are just powerful antihistamine mimicking action drugs. All right, my daughter, she says, has been taking her digestive enzymes, and they have helped her a lot. She forgot them on the trip she is currently on. Would a probiotic help her till she gets back? You know, I love probiotics. The older we get, the less we have in our gut, especially bifido and Bacteroides. In fact, the sicker you are, the less bifidobacteria and Bacteroides. And they look at families, for instance, on COVID, and some of the family don't get COVID and some do, all in the same household. And we do stool samples on them. And new research is coming out showing that the ones that didn't have the symptoms of COVID, their stool was rich in bifidobacteria. Children are rich in bifidobacteria, and that's why you want to try and keep them from unnecessary antibiotics and the like. All right, let me go back to these emails. Lee says, hi, Dr. Rita. My thyroid nodules have grown from 0.9 centimeters to 1.3 centimeters in a year and a half after they were the same size for 2 years. My endocrinologist said my thyroid blood test goes up and down, is dangerous and not good for my body, and recommends a thyroidectomy. I am 53 and have Graves' autoimmune, taking 5 milligrams of methimazole. And so that's usually associated with the Graves, where it can create that eye issue with the fibrous pressure on the eye. All right, and she's been taking that 3.5 years. She's been a TLC patient almost 2 years. I do TLC recommendations: low carb, exercise, drink lots of water, taking systemic enzymes, chelation, on her natural hormone creams, many supplements. What causes nodules to grow? What should I do to help shrink the nodules? How do I maintain T3, T4, TSH at good levels? Thank you so much, and God bless you. Lee, I would have to say most all my patients who do that have shrinkage of their nodules. So I'm going to presume that this is something in the diet that's commonly eaten that is a inflammatory food that you're taking, even though you're on a low carb diet. Probably the most quieting diet is the carnivore diet. So I would ask you to make a call to the office if you're a TLC patient here, to your doctor, so we can look at your case. Remember, we do these rounds, grand rounds monthly, and we can look at your case and address this. And I don't know what your last name is, so call here and identify that you had this question. And if I'm your doctor, let me know so I can pull your chart up and think on this case even more. Zoila, I'm a 59-year-old, 10 years postmenopausal with osteopenia, no other health concerns. What would be the ideal estrogen, progesterone blood levels for me? Thank you. In general, Zoila, I like to see women's estradiol to have meaningful impact on bone growth. I would like the progesterone to be greater than 4 or 5, and the estradiol to be, greater than 70 to have an impact. You could have a progesterone level up to 20, 30, 40, but at least above 4 or 5. You can have an estradiol up to 200, 300, but at least 70. So that would be where we would want to probably monitor you and do serial bone densities about every 2 years to make sure. But more importantly, or as importantly, is your vitamin D level. We would want that to be close to 80 to 90 micrograms per deciliter. Most doctors think that's too high. And then we would want you to eat a healthy diet and exercise with resistance training and stomping, sudden deceleration like a boxer hitting something for your arm, your radius and ulna, and then stomping with your legs, sudden deceleration to stimulate your bones that way. Carol says, my friend wants to know what research is available regarding hormone replacement therapy. She wants to understand and be able to talk to her doctor about balancing hormones. She would like your recommendations both on the internet and any recommended books that would help her to understand why women need hormone replacement therapy. And then she wants to present to her doctor. Well, good for her. I would recommend the book called Estrogen Matters. Estrogen Matters is written by a gynecologist to answer that very question. On the internet, there are many good YouTube videos about the value of natural hormone replacement therapy and hormones for many purposes: brain health, memory, your skin organ integrity, your cardiovascular system, your immune system, your bone health, your mood, your sense of energy and well-being, the rate at which you heal, the elastin collagen, and lack of wrinklings and drying out and getting dry eye vision protection. So there's so much there, Carol. I would read the book Estrogen Matters, and then I would go to the YouTube. Can I think of any one name? What one name could I? Well, if you go to our YouTube, if you go to our website, tlcdoctors.com, and on our website, then you'll see the button for our videos. And then if you go there and type in 2 gynecologists discuss hormone replacement therapy. And that is both Dr. Mitchell and Dr. Merrick, our gynecologists who work here, and they discuss all these questions. So that might be a help to you. Dawn says, have you ever advised a patient with undiagnosed tethered cord syndrome or Charcot Marie Tooth Disease? Yes, or chiari malformation. Where should a patient start if any of these conditions are a concern? Charcot Marie Tooth Disease affects peripheral nerves, including those responsible for breathing, heart rate, blood pressure, sweating, bladder control, which matches systems affected during night tremors experiences. Could sleep trauma events be related to brainstem dysfunction or B vitamin deficiencies? Symptoms presenting with methotetrahydrofolate, curled toes with high arches, claw feet, sacral dimpling, hemangioma on the back, sporadic headaches, sporadic urinary incontinence, sporadic nerve tingling, estrogen dominance, multiple cafe au lait birthmarks. Yes, Dawn, we have had many with Marie tooth disease, and affecting the peripheral nerves. And this is usually not serious. Now, we would not replace the neurologist, but we would work to help with the environment of the body, the metabolism, the nutrient deficiencies, especially regarding myelin sheath replacement and getting enough healthy phospholipids into your diet, where to find them, and how to track a healthy lipid profile and stop dietary measures that would hurt the myelin membrane so that you wouldn't be so susceptible to nerve damage. So yeah, we work with that, and we would ask you to see one of our doctors here at tlcdoctors.com. Mina says, what do you suggest when someone gets liver damage from taking PaxLovid? Well, of course, you stop PaxLovid. And number two, I would go on a richer carnivore-like diet to repair all those damaged cell membranes. You have to understand, those cell membranes are made of fat and protein. Remember these membranes here that we show all the time. The damage right here, whether it's a drug damage, a trauma, a viral, a toxin, you have to eat those phospholipids, essential fats to repair them. You have to have good microcirculation. So the same thing, we would give you a phospholipid-rich, more carnivore diet, because that's where all the phospholipids are in sufficient quantity. Yes, they're in some seeds and nuts, some plants in much lower quantities. You would wind up eating such huge bowls of fruits or vegetables and legumes and stuff to try and get enough phospholipids. It would be untenable compared to eating free-range sources of animal phospholipids. That's how we would work it, and we would be honored to try and help you here if you came to TLC, but find a functional doctor. EDTA chelation will help with the microcirculation. The very low carb diet will take the strain off the liver. Looking for other liver toxicants that should be removed from your diet, and so forth. Christina says, what is your opinion on cord blood storage? Is it worth keeping just in case a serious illness develops? So are you talking about your cord blood when you're delivering a baby from the placenta? And is that what you're saying in regard to for the child? I don't know enough about cord blood storage issues to advise you on that. So I'm going to have to pass on that one, Christina. Sorry. But I'll keep it here so I can look at it. That's unusual. And then I need to look up that emotion code. All right, Jennifer, for the past year or two, I've been dealing with excessive burping, which doctors have told this to just write off as nothing and didn't investigate. Over time, it's progressed in frequency, and I find it alarming. Over the last few months, I've been struggling with frequent bloating, nausea, constipation, fullness, loss of appetite. I eat healthfully. I don't eat processed fast food. I don't consume caffeine or a lot of sugar. I'm a non-smoker, could benefit from exercising more often than I do, and am an average weight for my height. These flare-ups are beginning to impact my day-to-day functioning, my ability to work, to leave the home for long periods of time as I continue to feel so uncomfortable. Laxatives, Miralax, and the sort don't help. I'm waiting to hear back from a gastroenterologist so I can schedule an appointment. I'm wondering if I have SIBO or irritable bowel or worse. I know I won't know until I'm tested by the gastroenterologist, but I was wondering if there was anything I could do in the meantime to help with this discomfort. I continue to feel almost every day. I just want to feel normal again. Thank you for your help. Well, Jennifer, how old are you? Very often, the older we get, the slower the motion of digestion. Do you have other comorbidities? If you're a diabetic, that slows digestion and the movement of food out of the stomach. The other thing, your blood type. If you're blood type A, the production of stomach acid and digestive enzymes tends to be lower in the blood type A. So a good digestive enzyme with betaine, hydrochloric acid, and maybe some ox bile to help with fat absorption. I mean, there's so many questions I would want to know. How often is your bowel movement? What is its consistency? Does it alternate loose and then hard? Have you had a colonoscopy? How late do you eat at night? What does your diet that you think is good consist of? You could be consistently eating a good food like a smoothie with spinach in it, but the oxalic acids, oxalates in it are very harmful for you. You could be eating a food sensitivity like that. You could not be eating enough fat or digesting it well enough if you're blood type A, and that will slow down the passage of stool. You could not have enough magnesium. You could be mineral deficient. You could have SIBO. I would want to look at a stool sample for your predominant flora. What kind of bacteria, good, bad, and ugly. What kind of digestion of fats, vegetable fibers, meat fibers. I would want to look at all these things and much, much more. So in the short term, you got to drink your water, half your weight in pounds as ounces of water. Probably take a digestive enzyme after every meal. We use orthodigestzyme here. The name of ours is called digestive enzymes or orthodigestzyme, 1 or 2 after each meal. I would never eat past 5 o'clock, and I would definitely exercise more, and probably I would get on a multi-mineral that has magnesium, potassium, calcium in it that is chelate to a mineral. That's our TLC multimin for the peristalsis. And I would just go ahead and probably take a good broad spectrum probiotic, orthobiotic 100, rich in bifidobacteria, because we lose it with age, and then the bad bacteria tend to take over. That's the direction I would go, and I would eat an extremely low starch, fruit, carbohydrate diet, extremely low. Harlow says, blessing, lovely doctor. Thank you, Harlow. I have a friend that is cleared from colon cancer 18 months already, but in the last 2 weeks, her stomach has been upset and what she describes as salmonella poisoning, but has tested negative for it and also for H. pylori. And her cancer tests came back negative. Well, we thank the Lord for that. What can I recommend she does to alleviate the stomach upset and banging headaches? What other tests can she do? Thank you. I think I would go on a fast. I would be on a water, chicken broth, beef broth fast for 2 days and have nothing else. And, in general, I don't know her other comorbidities, but typically resting the gut is very healing, and then using phospholipids, probiotic, and digestive enzymes with a very simplistic diet. I would probably start with scrambled eggs, lightly over eggs with a little butter on it. And I would use chicken roasted. I would use salmon. And I would stick with the eggs, chicken, and salmon with the digestive enzymes after a 2-day chicken broth, beef broth rest of the stomach. And see a functional doctor that can do a more thorough evaluation, get her age, get her parameters going, and take a look at her that way. Dr. Rita, what do you think of using Lyrica for fibromyalgia pain? Lyrica basically is just a Band-Aid covering up the symptoms, and it is like a dulling the nervous messages of pain, and I don't like Lyrica. Now, I'm not against it on occasional use, but I think a good doctor can work with their patient and work through the syndrome of fibromyalgia, which probably is a energy deficit of the mitochondria from cell membrane damage from all of the years and decades of these processed, hydrogenated, high carb junk foods that have damaged all these cells and gradually bring them back that way. Cindy says, my husband and I picked up a virus while in Denver after flying home. My ears plugged. In 8 days, they remain plugged, though a slight improvement occurs. Should we be concerned enough to see a doctor? I think they should have unplugged by now, now that you're down at sea level, because that's where we are. Denver's a mile high. Again, the most common thing that heals almost everything or improves almost everything is a 24-hour to 48-hour fast, just using water or chicken broth, systemic enzymes. And if your nose is plugged at all, I would use the Argentin nasal spray up my nose many times a day, especially before I lay down at night. And I would see if that pops them open and everything comes to normal then. Tara says, hello, Dr. Rita. Do you recommend modified citrus pectin for a gentle heavy metal and toxin detox? If so, what dosage do you recommend? Thank you. I usually don't, only because I know chelation intravenously is the best way to go. But I know citrus pectin does have some chelating ability, just as high-dose vitamin C does, just as cilantro, garlic does, chlorophyll does, zeolite, volcanic ash does have some benefit. So I would just follow the instructions on the citrus pectin. I know Orthomolecular makes this, and that's a reputable company. TJ says, Dr. Rita, I had a bad experience with DTPA about 2 years ago, and the cognitive response for me never really went away. In your experience, have you found DTPA to be toxic or cause neurological problems? There's a lot of information, and the doctor that prescribed the DTPA has no information as to why that would have happened. All right, I guess it's been a long day, TJ, and DTPA, that's drawing a blank. Is this a vaccination that you're talking about? So I'm going to have to get back to you on that. Dorothy said, what is the best way to keep your eyes healthy, prevent and reverse deterioration? Well, your eye is, just like the rest of your whole body, is marvelously made, but it's really a bunch of capillaries back there, as it also has the nerve in the center, optic nerve, and you have to have this excellent circulation. So a low-carb diet, taking enzymes, and eating foods that protect the cell membrane. And those membranes are made of a double layer of phospholipids and essential fats, linoleic and alpha-linoleic acid. And there's just so much to be said on that. I just have an article that I presented today for my journal contribution to the doctor's meeting. And it validates that everyone hates omega-6, but it's life essential. So how can you be teaching that omega-6 is bad and the ratio of omega-6 to omega-3 is always too much omega-6 I'll tell you what it is. It's because we've ruined omega-6s through hydrogenating all the double bonds in it, because it's in most foods and seeds, and they've ruined it through hydrogenation. So all the cell membranes are weak. It's like having construction and built it with faulty rafters and faulty foundation. So all the cells are weak. Hydrogenating all those double bonds in linoleic acid hurts everyone from child to elderly. And it isn't that we don't need omega-6s. We got to stop eating this corrupt, processed, hydrogenated, shelf life, cheap, easy processed foods. And we have to eat the healthy living sources such as meat, fish, chicken, pork, eggs, raw dairy, and so forth. Anyway, so that's my stance on that. That's how you keep your membranes to your eyes healthy. Let's do a few more on the chat here. Let's see. Christina says, hello, Dr. Ellithorpe. I hope you're doing wonderful. I have a few questions on traveling. Do you have any? We talked about the motion sickness. Christina also says, are there any supplements? And I brought up quercetin, which is a natural antihistamine. Traveling on an empty stomach, just on chicken broth, systemic enzymes, Argentine silver to spray up your nose. Okay, Gunnar says, what source of enzymes would you recommend for the varicocele? Well, I would say call our office here at TLC Vitamin Shop, 714-544-1521, and ask for the Vitamin Shop, and we'll send you the systemic enzymes or the Vitalzyme, because I've clinically tested those myself. You can't buy orthomolecular products as a consumer. Only doctors can. But we can give it to you through our systemic enzyme branding. The Vitalzyme is probably the most potent. That's a Japanese brand. Vitalzyme XE. There's 180 in Bristol little punch-out packets. But you need to take a lot, 5 twice a day. And then Tiziana says, hi, Dr. Rita. I developed an itchy skin rash under my armpits. What could I have going on in my gut that reflects in a rash? What can I do? I applied Argentine, not sure what else other than a low carb. Well, those are the two things I would start, is by using Argentine. It's antiviral, antifungal, antibacterial. The low carb diet, very much stress it. And don't be using cosmetic things. And I would not shave under your arms. I would let the hair grow there so that the pili calm down, the little area where the hair comes out from the skin. You could be getting a little folliculitis and thinking it's a rash when it's just the normal skin bacteria are irritated on it. And just wear, 3/4 length or short sleeve shirts as you're healing there, because I think we're over shaving and we get what we call folliculitis. All right, and then she said, thank you. So let's end up with, Debbie, here's one more. Debbie says, I went away for the weekend and had more dairy than I usually eat. The next day, my nose was inflamed and red. I know dairy is not really good, but I tolerate it in small amounts. Should I go off of it at all? The dairy is destroyed through homogenization and pasteurization. The healthy value of dairy is destroyed, and it's made into fractionated, abnormal liquid inflaming, I call it white fire water and white fire bricks as cheese if it's been homogenized and pasteurized. Therefore, I would not use any commercial products for dairy. I would only use raw dairy. And then I find people usually do very well with that, and it's very beneficial, helps cell membranes, it's got the right fats, it's got good enzymes, it helps you break down the proteins and the milk sugars, and so dairy is a wonderful product. Raw dairy, raw cheese is very good. Now, I would stay off of it for maybe a month and then go back only using raw dairy. That's how I would do that. All right, so Pamela says, I started taking selenium per your advice after my December thyroid ultrasound that showed lots of growth in nodules. After full thyroid panel, I started a small dose of T3 with my levothyroxine. I also did food sensitivities for the IgG and complement and removed eggs starting May 2nd. Got back on a high quality omega-3, then switched to algae form after testing. As of May 31, all of my thyroid nodules have decreased and my eyes have stopped tearing a while ago. Thank you for your advice because my endocrinologist said they didn't know why they would start growing. I'm so thankful to be learning about functional medicine. Do you have concerns about omega-3 supplementation? Well, you don't need fish oil. What you need is linoleic and alpha-linolenic acid. The omega-6 and omega-3 are the only two human fatty acids that you need. That's why we use this source here, clinician's preference oils, 2 twice a day, and or eat the wild caught fish and the wild caught prairie raised meat, grass fed, prairie raised chicken with the yolk. Don't hard boil it. It's better if it's runny. But that's how I feel about that. Oh, praise the Lord, Pamela. Debbie, oh, my sister. Hi, Debbie. I am working hard with my recovery from my broken femur hip replacement. Yeah, my sister fell off her porch and really took a hit onto her hip and she broke it, even though she had excellent labs on hormones, on the vitamin D, and only slight osteopenia. But the force and the distance of the fall, anybody would have broken a bone. So she's taking her supplements, low carb, drinking water, her hydrogenated water. That's the Izumi water. Systemic enzymes, doing physical therapy. My leg is still swollen. Anything else I can do for this, or is it just time? Thank you and blessings always. I think it's just time because it's only 2.5 weeks since you broke your hip. And you're starting to go through the stress of the rehab right now. So I would be more patient, Debbie. And then, of course, call me at home and let me know. And so we have 2 minutes left. My last question of the night will be from Alina. Hi, Dr. Rita. I'm in my 30s, and I wrote back to you in August with the encouragement of my friend Phyllis when I first was diagnosed with multiple fibroid tumors, polyps, and mild endometriosis. I then became a patient of TLC at the end of August. I had my successful and almost 6-hour laparoscopic myomectomy at the end of March 2023. At my 2-week post-surgery appointment, my surgeon, GYN, I had mentioned and showed her a picture of white clumpy discharge every time I would urinate that was concerning me. She only did a visual exam and discarded it as normal healing without sending me to have any labs. 2 weeks later, I contacted her again of the persistent issue, and she suggested I make an appointment with my primary care physician. I have still not been able to see my primary care physician yet because it takes 2 months to see her, but thank God I had an appointment with Dr. Mitchell, who 2 weeks ago, and she listened to my concerns and had me take a urine sample to discover that I did indeed have a issue, which was an infection. I am on antibiotics now. Sadly, it took over 2 months to discover, and by the second month, I was having additional symptoms of daily headaches, nausea, cramping, terrible fatigue, and back pains. In speaking to my friend Phyllis, she suggested I ask you a question. Would it be beneficial for me to have a vitamin C IV or detox IV at TLC to help? Since I had this infection for so long, I have never been suggested by any of the physicians there to do the IV treatments yet. How could I get one, or is there anything you additionally suggest taken orally instead to help clean my system? Thank you, Dr. Rita. Well, one of the fastest ways to heal anything is, like I said, do a 24-hour to 48-hour fast, water fast, or with chicken broth while you're finishing your antibiotics and all. Vitamin C always builds the immune system up. So our immune drip 25 gram is an immune builder, and it may be of great help to you. The vitamin C is also in what we call our detox enhanced chelation with minerals, as well as the ability to pull out toxic heavy metals. Just call the office and ask Dr. Mitchell for a immune drip vitamin C or a enhanced chelation IV. And of course, hopefully you're going to get a repeat urine sample in 2 weeks, and make sure that everything is cleared out, and a follow-up visit with your doctor or one of us here. But I'm so glad that our Dr. Mitchell here was able to help you, and she can order that IV for you, which I do think is very beneficial for the immune system. The reason why I tend to think that the enhanced chelation is better is because the microcirculation will improve in the kidneys themselves with chelation, and that helps, so to say, flush them out, although it does sound like you just had a bladder infection. Either way, Elena, call Dr. Mitchell and talk with her about it, but superficially, from what I can see, that would be a big help. So I want to thank you all. The Lord bless you and keep you, and keep us focused on treating one another with respect and love. And we give God all the glory. All right, have a great night until next week. Remember to like and subscribe. Put some comment under, that helps us. And we'll see you next week. Bye-bye.